False belief about the transmission of HIV AIDS and the stigma has led many people to keep silent about their status. Sudan is no exception.
A call to worship is sounded in Kassala, the capital of the eastern state of Sudan. Worshippers are gathered for the Friday prayers, waiting to receive a message. Today's message addresses compassion in the faith, but the messenger has added a little twist to the story. Imam Tariq Muhammad is talking about HIV and AIDS for the first time in this mosque. A major concern when religious leaders like Tariq talk about HIV and AIDS is how to address the use of condoms and how people interpret the message. Most religious leaders shy away from the topic, but not Tariq Muhammad.
We support the opinions of doctors and those who have the expertise in this field. If they say it should be used, then we endorse their views and do not contest it. However, in both religions, we encourage people to abstain, as the use of condom can be misinterpreted to encourage promiscuity.
AIDS and sexuality remain a major taboo in the predominantly Islamic northern Sudan. According to the UN AIDS report in 2008, Sudan has the highest HIV epidemic infection in the Middle East and North Africa, with up to 420,000 people living with the disease. As the figures rise, Sudan struggles with a lack of awareness of the epidemic. The country still does not have a national condom campaign, and sex and HIV education is still at a very early stage. It is for this reason that the United Nations Development Programme started involving religious leaders in Sudan to spread the message.
The opinion of religious leaders matters, especially when it comes to sensitive issues such as AIDS and sexuality. That's why UNDP and Sudan National AIDS Programme mobilized and trained 175 imams and priests to teach people how to prevent HIV, how to treat AIDS, how to end stigma, and most importantly, how to remind everyone that AIDS is not a punishment from God, but rather a disease that people can live with.
The stigma associated with AIDS is the main reason why people don't talk openly about the disease. Asha Masood is HIV positive and has been living with the disease for over 4 years. She asked us not to use her real name and that her identity be hidden. The more people know that she is HIV positive, the harder things will become. She got the disease from her husband, who was expelled from the UAE in 2002 when they found out he had the disease. Her husband died in 2004, and 5 months later, Asha's little daughter died as well. She has 2 other children, one of whom is also HIV positive.
The villagers say that no one should deal with me and that I should immediately be carried outside the village and that the car that takes me should be burnt down. They said I should have nothing to do with our tribe. I was isolated and I became the poor woman. I even thought of buying hair dye and swallowing it in order to kill myself.
Unlike Asha, Al-Sawi Ali Taha has been very vocal about his status. He is also HIV positive and has been trying to live a normal life, but speaking about the disease has often got him into trouble. He's been evicted from a number of houses and abandoned by his family members.
People have told me on my face that I'm a fraud, that I do it for the money. They ask how can I have AIDS for 10 years and yet I'm still healthy. We really hope that people get more information about this disease in order to end the stereotype image of an individual who's frail and whose health condition is deteriorating.
Kassala state borders Ethiopia and Eritrea and is believed to be one of the most vulnerable to HIV infections among the northern Sudanese states. With an estimated 2.5 million people, the state only has 3 voluntary end testing centers, 2 of which are based in the city. The state still needs to reach out to the rural areas that constitute most of its population. Kassala State Minister of Health, Mohammed Salih Abed, admits that the situation has become serious since Sudan's last national HIV survey, which was conducted in 2002.
It's not possible to give an exact percentage of the prevalence of the disease, but we are admitting that the disease is here in Kassala State with a high prevalence rate due to the fact that it shares borders with 2 neighboring countries. While testing for HIV AIDS, we found out that out of 100 cases, 30 are positive.
Abdelazim works for the voluntary testing center at the hospital in Kassala. He says there's been an increase in the numbers over the years. In 2005, they only had 112 people tested, but currently over 1,000 people have been tested this year alone.
People are hesitant to approach the VCT. Some say that they have thought about visiting the VCT for a month or 2 before they actually approached it. One of the solutions we have found in order to overcome this problem of hesitancy is to introduce mobile VCT, a solution we use for 2 months now and which has met with huge success. In the past 2 months, the number of those who were tested using the mobile VCT exceeded the number of clients who visited the VCT in Kassala Hospital.
When not at the VCT center, Abdelazim spends most of his time as a volunteer with the People Living with AIDS Association. The group was formed in 2005 by Sudan's National AIDS Program to provide support to HIV-positive individuals and their families and to create awareness on the disease. In Kassala, there are currently 120 active members of the association, 50 of whom are living with HIV/AIDS.
Interacting with others who have the disease, we have noticed that when the psychological status of the HIV-positive individual improves, then consequently their medical condition also improves.
Although they meet regularly and have found a place they can be free from stigma, they all know too well the realities of their status and the consequences.
I wish to talk about this disease openly so that people become aware of its modes of transmission. People should take precautions since it's a dangerous disease that has no cure.
AIDS is a social problem and has worse impact than any other medical condition. I personally feel that medical problems can be endured, but the stigma of HIV is what cannot be endured.
As the sun goes down each day, they can only hope that one day they would wake up to a world that accepts them.